Hello everyone. So we have a 55-year-old man brought to emergency due to unusual movement of his face and extremities. And it is noted that he's sticking out his tongue, smacking the lips, and twisting the body from side to side. Okay. He has a history of schizoaffective disorder and is being treated with risperidone, fluoxetine, and clonazepam for 20 years. Well, examination shows protruding and twisting movement of the tongue, dystonic posture of the neck, squaring movement of the torso. Most likely underlying cause of the patient's symptom is. Well, the answer to this question is C, dopamine receptor supersensitivity. Well, this patient exhibits classically features of tardive dyskinesia, what we write in as a TD. But before I proceed further, I have a question for you. Stop the video, write down the answer. The question is, what is tardive dyskinesia? Well, it is an involuntary movement associated with dopamine blocking agent. Now, in this case, we are giving risperidone. Which we know is a dopamine blocking agent. And classically now in tardive dyskinesia, orofacial dyskinesia, rhythmic movement of the face, lips and tongue that we have seen in this our patient also. Okay. And chorioarthroid movement of the tongue and extremity, the way the patient is moving torso from one place to other. Right. Now, TD is most commonly associated with prolonged use, like in our case, the patient has been using risperidone for the last 20 years of antipsychotic medication. It typically presents with chronic and psychotic disorder. Definitely, it is used after long use. So this usually not a case of acute. If the question is like it is a history of 3 days, then tardive dyskinesia is not the right answer because this occurs only after chronic use. This is used for chronic psychotic disorders. Well, it is more common with the first generation antipsychotic and because they are potent D2 blocker, but it can also occur with second generation antipsychotics such as risperidone. And in our case, the patient is being treated with the risperidone only, which is a second generation, but it can occur. Well, now, what's the reason why this happened? This again a very important question. Pathophysiology of TD is thought to involve dopamine 2 receptor upregulation, and that is to supersensitivity resulting from chronic blockade of dopamine receptor. Okay, so it is the upregulation and supersensitivity are the two reasons, especially of dopamine D2 receptor. Now, of course, there are other theories also. Imbalance between dopamine D1 receptor and dopamine D2 receptor in the basal ganglia, as well as excitotoxic destruction of GABA neuron in the corpus striatum. This is again a second theory, but this is more widely accepted theory. Anyway, let's look into other option. Option A, caudate nucleus atrophy. This is an incorrect answer because, and this is seen in Huntington disease, is an inherited progressive neurodegenerative disorder. Point to note it, it's inherited. Now, it's an autosomal dominant. And the main thing, although it's dominant, but usually manifests in the middle age, 30 to 45 years is the usual age of manifestation. Although it can occur below 30 also, and it can occur after 45 also. But this is the usual age where it is manifest. Well, it's characterized by coriform movement, psychiatric symptom, and dementia. And this again a very, very important point that we see in this. It not thought to play in tardive TD pathogenesis. It has got nothing to role. Now, regarding option B, dopamine receptor downregulation, as we discussed previously also, it is the upregulation, not the downregulation of dopamine receptor, that this option automatically ruled out. Option D and E, GABA receptor upregulation and glutamate receptor supersensitivity. GABA receptor upregulation and glutamate receptor supersensitivity are not thought to play a role, and as I mentioned in the theory too, that it is the down regulation of GABA receptor, not up regulation. So, golden line to remember regarding tardive dyskinesia, they are involuntary movement, and dopamine blocking drug like risperidone, and the classically movement, they are orofacial dyskinesia and chorioathetoid movement. To remember these two very, very important point. Okay. Thank you very much.